హాయ్ వెల్కమ్ టు కేర్ సంవాద్ విత్ మీ మిర్చి హేమంత్ అండ్ ఎస్ ఈరోజు నాతో పాటు ఉన్నారు ద ఈఎన్టీ స్పెషలిస్ట్ డాక్టర్ విష్ణు స్వరూప్ రెడ్డి గారు. సార్ అసలు విష్ణు స్వరూప్ రెడ్డి గారితో నేను ఇంటర్వ్యూ చేస్తున్నాను అనగానే అసలు నేను ఒకసారి అటు యూట్యూబ్లోకి గూగుల్లోకి వెళ్ళి అసలు మీరు ద గ్రేట్ ట్రాక్ రికార్డ్ ఏంటి అని చూస్తే కొంచెం భయపెట్టే లెవెల్లోనే ఉంది సార్. అంటే వాట్ ఐవ్ సీన్ ఈస్ ఓవర్ ద 3 decades ఆఫ్ యువర్ ఎక్స్పీరియన్స్, అంటే విత్ రిగార్డ్స్ టు ఈఎన్టీ కానీ, ఫేషియల్ ప్లాస్టిక్ సర్జరీ, కోక్లియర్ ఇంప్లాంట్స్, స్కల్ బేస్ సర్జరీ, ఇవన్నీ చూసినప్పుడు నాకు వచ్చిన ఫస్ట్ థాట్ ఈస్ వాట్ మేడ్ యూ స్పెషలైజ్ ఇన్ దిస్ సెక్టర్, ఇన్ దిస్ ఫీల్డ్?
See, when I started my post-graduation and way back in 88-91, I did my MS in ENT. So the main attraction for me to do ENT was cosmetic surgery of the nose. Okay, if I do ENT, if I take MS ENT and do 3 years post-graduation and then progress, okay, I'm going to make people nose better. Okay. That was really something was charming for me. And of course, the other things are there like hearing. You make people hear. Those who are not hearing, immediately they start hearing on the table, especially adults. When we do surgery under local anesthesia, that is rather thrilling as well. And of course, same thing with the breathing. You know, we correct the nose, and not only shape and breathing also we improve. At the same time, with the voice, we see patients with a voice problem and with hoarseness of voice, and we make them better. Straight away, the results are seen. So, such an impact, immediate results, especially on the day of operation, on the operation table itself, when it comes to the hearing, then it's very exciting. And there is it's a matter of science and art. I thought this is going to have a very good human impact. I think this should be my choice of subjects. That's how I chosen ENT when I started.
సార్ మీరు వాయిస్ అంటున్నారు, ఒకసారి నాది బాగానే ఉందని చెప్పండి. ఓకేనా?
It sounds good.
Okay.
It sounds good.
మీరు చెప్పారంటే కరెక్ట్.
Thank you.
Sir, you've studied extensively in UK, US, Germany, Austria. ఇన్ని వేరియడ్ ప్లేసెస్లో ప్రపంచవ్యాప్తంగా మీరు చదువుకోవడం అనేది మీ సర్జికల్ ఫిలాసఫీని ఎలా ఇన్ఫ్లుయెన్స్ చేసింది?
No, basically I completed my MS in Tirupati SV Medical College, and then I went and worked with a very well-renowned ENT surgeon from Bangalore, and he is well known to every ENT surgeon in this country. His name is Dr. Mahadevaya. He is my guru. I worked with him for 2 years after my MS in ENT at Bangalore. Then he encouraged me that you should go and he was trained in America. He encouraged me to go to England. That's how I went to England in 93 with his encouragement. And after going to England in 93, up to 2003 I was there. And then my intention was always to come back home. That is the ultimate goal actually. That's why I didn't want to go actually to start with. But he encouraged and my parents encouraged. There's an opportunity to go there and do FRCS, which is a well-known qualification for surgeon from 500-year-old Royal College of Surgeons. You should go. And then that's how I went. And having been there, I had my training in Royal National ENT Hospital in London. It is an overall comprehensive training. And I worked as a consultant also in the National Health Service. And 10 years have gone by, and then I became a citizen of Britain as well. But finally my aim is to come back home and serve our own people. So that was the whole intention. I don't want to settle there. It's not my home country. Your passport may be British, but you can never be British. It's always, so we love our country. That's how I came back. But I planned my career in such a way. When I was there, I went to USA, and there's a world-renowned House Ear Institute. It's very well known, where I had a special training on cochlear implants, brainstem implants, and all microscopic ear surgery in Los Angeles. I did a fellowship there, and I have a fascination for nose plastic surgery. So I went to Germany, in Stuttgart, where Mercedes cars are made. And in a Marian hospital there, I had an opportunity to get trained under Professor Wolfgang Gubisch. He is a facial plastic surgeon. He does wonderful nose plastic surgery and facial plastic surgery. Facial plastic surgery means, you may have a doubt that why ENT? Yes, children born without ears, outer ears. We take the rib and shape the cartilage and bury under the skin, and also we give the hearing as well. That is facial plastic surgery. And nose, of course, breathing and shaping of the nose is, rhinoplasty is also facial plastic surgery. And also people, we do tumors from the ear and they come with paralysis of the face. And restoring the function of the facial nerve is also facial plastic surgery. That's why there's a major role of ENT surgeon in facial plastic surgery. That's how I got trained in Germany, facial plastic surgery. Then I went to Paris and had a training on laser voice surgery. Voice is also equally important for, all of us in day-to-day life. Then again I went to nose and sinus surgery. He's a well-known, he's a father of endoscopic sinus surgery. His name is Stamberger, Professor Stamberger. He's he started the endoscopic sinus surgery, keyhole surgery in the nose. That was in Graz, Austria. There I had opportunity to go and spend some time and learned endoscopic sinus surgery and endoscopic skull-base surgery. And of course Australia also I have been for advanced cochlear implant training, and in Germany as well, the micro ear surgery and auditory brainstem implant surgery. And so these kind of opportunity you will never get when you come back to India. That's why I have made a plan to go all around and then get trained in all these subspecialties of ENT and come back and serve our own country people, and that gives me immense happiness. So that's how my training has blended with Western training, and then that's why I'm capable of doing anything from ENT, head and neck and facial plastic surgery point of view, anything to my patient in India. That's the happiness I have now.
Sir,
థ్యాంక్ యూ.
అంటే మీరు ఇన్ని చెప్తుంటే మై నెక్స్ట్ క్వశ్చన్ ఈస్, మీరు బయోపిక్ ఎప్పుడు తీస్తున్నారు చెప్పండి.
బయోపిక్
సార్, ఓవర్ ది ఇయర్స్ ఇఫ్ యు సీ, హెల్త్ కేర్ హ్యాస్ బికమ్ మోడర్న్ హెల్త్ కేర్. అండ్ మోడర్న్ హెల్త్ కేర్ బీసీ రోజుకి ఒక కొత్త టెక్నాలజీ, కొత్త మోడర్న్ ఎక్విప్మెంట్ లాంటివి వస్తున్నాయి, ఇవాల్వింగ్ ఎవ్రీ డే. ఇందులో భాగంగా ఈఎన్టీ అనేది ఈ మోడర్న్ హెల్త్ కేర్ లో ఎంత క్విక్ గా ఎటువైపున ఇవాల్వ్ అవుతుంది చెప్పండి.
See, once upon a time, many years ago, 3-4 decades ago, ENT was not that popular because it was only confined to the tonsils, throat surgery, or correcting the deviation of the septum. But last 3 to 4 decades, with the the endoscopic sinus surgery started in 90s. Endoscope comes like a 4 millimeter telescope. We just put it in the nose, and then it is connected to the camera. Nostrils are so small, but inside you have huge areas. You can see all the structures, and that will show on the camera. So that's how you diagnose better with the nasal endoscope. That's a great advancement happened in 90s. And also with the endoscope, we go through the sinuses into the pituitary gland and remove tumors from the pituitary gland. So through transsphenoidal pituitary surgery is also an advancement in the endoscopical. Earlier we used to use a microscope, and we do combined work with the neurosurgeons, and we have this CT navigation is one thing. That's the first time I started at Care Hospitals in the year 2010. CT navigation. You have a pre-operative CT scan cuts. They amalgamate, and based on that, we use a device, the navigation surgery. It comes with a navigation tool. You put it in the nose, and it will show you where you are.
Okay.
Are you very close to the brain? Are you close to the eye optic nerves? Are close to the big vessels? Close to the sphenoid sinus, where you have the pituitary tumor. Pituitary gland is above the sphenoid sinus. So that is a great advancement to do the, without doing the craniotomy, without opening the skull, we go through the nose and remove the brain tumors.
Right.
That's a great advancement. In the same way, cochlear implants, those who are severe to profoundly deaf, up to 70-75 decibels, hearing problem, the hearing aids will work. But if it is more than that, you need the cochlear implant to, get the hearing. We put an electrode in the cochlea, inner ear, and stimulate the nerve. That's how the cochlear implant works.
Yeah.
So that is also another advancement. As I said, on robotic surgery is also a tool where we do for oropharyngeal tumors and snoring and obstructive sleep apnea surgery. So like that, there are so many advancements happen in ENT. And I said the facial plastic surgery is also an attraction. And voice surgery. There are so many subspecialties evolved in ENT surgery. That's why it became very popular nowadays.
And everything is very, very important also.
Absolutely.
Right.
So they improve the function and they improve your relations. The other thing is basically overall the quality of life changes.
Yes.
With the ENT surgeries.
Yes.
And immediate on the table results also. That is exciting for me.
Also, sir, and if I have to look back, you've performed over 1,000 successful stapedotomy surgeries for otosclerosis.
Correct.
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 Can you explain what this condition is and how a surgery transforms that patient's life?
Excellent question. The otosclerosis is, we have the eardrum, ear canal, eardrum. Behind that you have 3 bones. Eardrum is like a paper. And you have a middle ear behind the eardrum. There are 3 bones like a chain. They're very tiny bones. The stapes is the smallest bone in the human body.
Okay.
That sits on the entrance of the inner ear. That's how the sound waves travel by the vibration of the eardrum and 3 bone chain in the middle ear into the inner ear fluids. From there the hearing nerve starts. That's how the sound goes in.
Okay.
So this 3rd bone gets fixed. It doesn't move. That is a hereditary condition which runs in families. So that's a very common cause of hearing loss in the population. So with that stapes bone getting fixed is called otosclerosis. With that condition, the patient will not be able to hear because there is no conduction into the inner ear. Sound will not be conducted. We replace that stapes bone with a Teflon piston by using some special drills like a skeeter drill. We make an opening in the inner ear with 0.6 millimeter and then we put a Teflon piston 0.4 millimeter diameter. We remove the stapes and put a Teflon piston that hooks to the 2nd bone.
Okay.
And when you lift the eardrum, we do this, and when you close the eardrum, the patient starts hearing on the table immediately.
Right.
Because we do this under local anesthesia. That is the thrill of the surgery. Very satisfying for the surgeon and for the patient as well.
Oh.
And for your information, we have published our results, the 1,000 plus. Actually, that was in 2019. We have done 1,000 plus. Now we are 2,000 plus.
Wow.
And when we were in 2021, we published our 10 years follow-up hearing results in a Cambridge journal, Journal of Laryngology and Otology. And this is the largest publication from India and 2nd largest in the world. So that is that's how it's so thrilling. That's what is the otosclerosis and the stapedotomy surgery.
Wow. So Winterton is such a big high, sir. And also the fact that, I'm sure, the cochlear implants that you're doing, they're absolutely life-changing.
Correct.
Especially with regards to children.
Right.
However, my point is, అసలు ఈ ఆప్షన్ పిక్ చేసుకునే ముందు పేరెంట్స్ especially తీసుకోవాల్సిన జాగ్రత్తలు ఏంటి? What should they keep in mind?
Right. See, basically cochlear implant, starting from childhood to the adults, cochlear implant is for those who are not getting benefit using a hearing aid. That is the simplest expression of who needs cochlear implant. It's an expensive device. It will cost from 6.5 lakhs to 16-17 lakhs for each year. So who needs this? About 75 decibel hearing loss, above that, more than that. Those are the candidates, whether children or adults, who the candidates for the cochlear implant surgery. For them, above 75 to 80, the hearing aids will not work. See, unless the hearing is there, then only the speech develops for the child. That's why early diagnosis is very, very important. When the child is born, we do the hearing test now. At that time, we follow whether it is a mild, moderate, severe. If it is mild, moderate, you can give a hearing aid. If not, if it is severe to profound, we have to do the cochlear implant surgery to make them hear. By age of 1 year, we can do, or even younger also we have done. But ideal age is 1 to 3 years. Sometimes we do up to 5 years, but best age is 1 year or 2 years, maximum 3 years. Then the child can get normal hearing, and once the sound goes in, they get normal speech, and so they can go to normal schools. We can do both the sides and give 360 degrees hearing.
Oh.
Yeah. So that's how we make the child hear. So the age criteria is 1 to 3 years is the best time. Not only for children, adults we can do any age. Any age, if they lost hearing, somebody is not hearing, any age you can do. I do cochlear implant surgery under local anesthesia, and then make the patient hear immediately on the table.
Wow.
So we have done the highest number, again, in India, under local anesthesia, the cochlear implant surgery. I started for a patient who came from Saudi Arabia with a single lung.
Okay.
He had only one lung and he was not fit for general anesthesia. So then I was bound to start under local anesthesia. Otherwise, we always used to do under general anesthesia. That's how I started a patient with a single lung who was not fit for GA, and then we continued. Now we have the largest series of cochlear implant surgeries under local anesthesia. So this is very thrilling actually.
Yeah.
The patient who is profoundly deaf, he starts hearing on the table. So that's very satisfying again. This is for severe to profound category.
Yeah. And also, sir, the other point would be sinusitis. Sinusitis anedi, it became very common these days, right?
Correct.
So, but patients often try home remedies for this, correct? Right. So, what complications can arise from untreated chronic sinusitis?
Yeah. Generally, it's such a common thing, as you said. It affects the quality of life, and then blocked nose, not able to sleep well, and facial pain, and postnasal discharge, cough. These symptoms, are very, very common. One of the commonest causes in our ENT practice. So these patients generally, they have usually breathing difficulty because the partition in the nose is called septum, that is bent for a lot of people. So once it is bent, you can't breathe very well. Then the sinuses are in the face, like airbags. 2 here, 2 in between the eyes, 2 behind the cheeks, 2 close to the brain. 8 sinuses are there in the face. They are filled with air. They have a sinus drainages in the side wall of the nose. If the drainages are blocked because of poor breathing, then inside secretions will accumulate. That's how it is the sinusitis. Then you feel heaviness of the face, blocked nose, and other resultant symptoms. That's a common problem. Generally, it gets better. It starts with a viral infection, and then bacteria will add on to it. With simple home remedy, it may get better if it is simple cold. But if it is extending into the sinuses and collecting pus in the sinuses, then you need a course of antibiotics. So that's how the treatment is. They need at least 7 to 10 days of antibiotic and some anti-allergics. Now they get better. Suppose if it is recurring, if it is coming again and again, then it becomes chronic. Then we have to do a CT scan of the sinuses.
Correct.
That's how we diagnose it, the sinusitis.
Yeah.
So, yeah.
No, my point was untreated how dangerous will that be?
Yeah, good question. Yeah, if you neglect the blocked nose, it may lead into fungal infections in the sinuses. Some mud-like material will accumulate in the sinuses, and it can extend into the infection can extend into the eyes. Mainly, eyes are nearby. Orbital infections, or sometimes, very rarely, meningitis. Those kind of infections can occur. That's why it cannot be neglected.
Oh, sir, Naku, I have a round called the rapid care round.
Okay.
I want you to answer this in one word. All right? Here we go. First one, sir. One word that describes your surgical style.
Okay. It is precise and meticulous.
Precise and meticulous. Okay. Ear, nose, or throat. Which surgery excites you the most?
ear surgery because I make the patient hear straight away on the table.
Right. Biggest myth with regards to snoring?
Yes, snoring cannot be taken simply because obstructive sleep apnea may be there.
Okay. Medical gadget or tool that you can't live without?
And nasal endoscopes and the microscope, operating microscope.
One innovation that has completely changed ENT in the last decade?
As I said again, the CT navigation is one thing, and the other thing like robos.
If not an ENT surgeon, what would you have been?
Probably a musician because I love hearing and music. Thank you.
Your favorite global center for training experience?
That was in Austria, in Graz, University of Graz in Austria, where I had a endoscopic sinus surgery and skull-base surgery training.
One piece of advice you'd give to young ENT doctors starting the journey?
Yes, it is a very exciting field, and they should concentrate on detailed history of the patient. That's very, very important. Detailed history and detailed, examination, thorough examination will certainly give you a diagnosis. And there are a lot of exciting things you can do, like I already told you.
Yeah. The most memorable thank you you've received from a patient?
2-3, I would say. I operated a blind person and he was deaf as well. And when he got hearing and his happiness, I can't imagine the amount of happiness we had.
Correct.
That is one thing.
I am just able to imagine that person, right? It must be so.
Another thing is cochlear implant surgery.
Yeah.
When the child starts hearing and mother's happiness, when we switch on the cochlear implant after the surgery, and when she hears her mother's voice, and it's an amazing experience.
Wow. One last question, sir. Complete the sentence. Healthy ears, nose and throat mean? Finish the sentence, sir. Healthy ears,
Yes.
nose and throat mean?
Yes, giving the hearing, breathing, and voice.
Yeah, totally get it. Thank you so much, doctor. You got
Thank you so
to
much,
learn so much from this. And like you said, elanti chinna red signal maak vinipinchina ventane will come and see a doctor.
Thanks a lot. It's a pleasure meeting you.
Thank you so much, doctor.
All the best.
Right,
Thank
sir.
you.